Something permanent happens to your body during pregnancy that nobody explains. You walk out of those 9 months as a structurally different person. Not just emotionally, not just in how deeply you love or feel. Physically, architecturally, permanently. Your body rewrites itself from the inside out. Most of these changes happen quietly, almost without fanfare or any warning. They start so subtle, you might mistake them for nothing at all. Then one day, something just does not fit the way it always did. Your shoes, your ribs, your teeth, your vision, quietly, permanently altered. These are 7 things pregnancy does to your body that almost nobody tells you. Some of them are temporary, some are not, and some will genuinely surprise you. Your shoes stopped fitting. And they are not coming back. Not from swelling, not from water weight, not from anything remotely temporary. Your feet have permanently grown, in many cases by half a full shoe size. And the biology behind that. Growth goes deeper than most people ever realize. During pregnancy, your body produces a hormone with a precise and elegant name: relaxin. Its entire job is to loosen the ligaments in your pelvis before delivery. This creates enough flexibility for a growing baby to eventually pass through safely. Smart? Necessary system. But relaxin does not stay where it is sent. It floods your entire body and loosens ligaments wherever it happens to travel. Your foot contains 26 bones held in place by dozens of small ligaments. When those ligaments soften, the entire architecture of your foot begins to shift. The arch flattens, the width broadens, and the overall length of the foot increases. By late pregnancy, many women measure a full half size larger than before. When delivery is over, relaxin levels fall and your ligaments begin tightening again. But they tighten around the new position, not the original one. The bones have already settled into their new coordinates and intend to stay. Women who have multiple pregnancies sometimes find they go up a full size over time, not a rounding up on a sizing chart, a genuine full shoe size increase. Your body quietly redesigned its own foundation to carry something new and heavy. And it kept the redesign long after that weight had been lifted. Your heart grows during pregnancy, not metaphorically, but physically and measurably. This is not a poetic idea or a sentimental figure of speech. Your actual cardiac muscle expands in size across the course of your pregnancy. The reason is as mechanical as anything in human biology can get. Blood volume increases by roughly 50% above your normal pre-pregnancy baseline. Your body manufactures that much additional blood to sustain 2 separate circulatory systems. Your heart is essentially a pump, and someone has dramatically increased the workload. So it does what any muscle under sustained heavy load does. It grows, it thickens, and it strengthens to keep pace with the new demand. The walls of the left ventricle expand to push blood harder through the body. Your resting heart rate climbs by 10 to 20 beats above your usual number. That breathlessness you feel climbing a single flight of stairs makes complete sense now. Your cardiovascular system is running a sustained marathon it never agreed to enter. Blood is constantly rerouted and prioritized toward the uterus, the placenta, and the baby. And here is the part that most doctors never take the time to explain. Some of that cardiac remodeling does not reverse after pregnancy ends. Studies show the heart retains measurable structural differences years after delivery. For most women, this is benign, even linked to long-term cardiovascular benefit. But it means the heart beating in your chest is now structurally different from before. Pregnancy rewired the organ keeping you alive, and it kept the rewiring. You might have noticed your voice sounding different while you were pregnant. Lower, slightly rougher, harder to reach the upper notes you used to own. Professional singers notice it most acutely, sometimes dramatically and even career-alteringly. But it happens to almost every pregnant woman, quietly and without any announcement. Estrogen and progesterone both cause fluid retention in soft tissue throughout your body. One of the places they target very specifically is your vocal cords. Vocal cords are bands of delicate, soft tissue that vibrate when air passes through. When they swell with fluid, the way they vibrate changes entirely. The pitch drops, the tone thickens, and the texture of your voice shifts. Some women find their voice becomes richer and darker during pregnancy. Others simply lose the upper register they spent years carefully training to reach. Opera companies have been forced to reschedule major performances because of pregnant sopranos. Studio singers have delayed album recordings by months just waiting for their voices. Your vocal cords are instruments of precision, tuned carefully over your entire lifetime. Pregnancy detunes them, sometimes temporarily, sometimes with subtle shifts that linger afterward. For most women, the voice returns toward its original sound within months of birth, but some notice a depth or resonance that was not quite there before. The voice that crossed that experience came out the other side carrying it, and the child who hears it every single day will never know the prior version. Your vision gets blurry during pregnancy, and the reason is genuinely strange. It is not your prescription worsening or your eyesight declining in any conventional sense. It is the physical shape of your eyeballs shifting from built-up fluid pressure. Fluid retention during pregnancy is relentless and not selective about where it accumulates. It pools in your ankles, your hands, your fingers, your face, your eyelids, and it builds up in the soft tissues immediately surrounding your eyes. That pressure alters the curvature of your cornea, the clear dome of your eye. When the cornea's shape changes, the way light bends through it changes with it. The image arriving at your retina no longer lands in quite the right place. Contact lenses that were perfectly calibrated may suddenly feel wrong and uncomfortable on your eyes. Glasses prescriptions that were accurate for years can become temporarily unreliable. Optometrists routinely advise against updating your prescription while you are pregnant. The changes are likely to reverse within weeks after birth as fluid redistributes. New lenses bought during pregnancy could become obsolete before you fully adjust to them. But this part of the story has a more serious dimension worth knowing about. Sudden or dramatic vision changes in pregnancy can sometimes signal elevated blood pressure, or a condition called preeclampsia, which requires immediate and urgent medical evaluation. So blurry vision in pregnancy sits in this strange and complicated dual space. It can be completely ordinary, or it can be a warning worth acting on quickly. Your eyes are always trying to tell you something. Pregnancy just amplifies the message. Nobody adequately prepares you for what happens to your ribcage during pregnancy. By the third trimester, your ribs physically expand outward from the center of your body, not only because the baby is pressing up against them from below, but because relaxin reaches the cartilage connecting your ribs to your sternum. That cartilage softens and loosens, and the entire ribcage begins to flare outward. Your torso is making real architectural adjustments to accommodate what is growing inside you. This expansion can add actual measurable centimeters to your chest circumference over time. Women measured carefully before and after pregnancy sometimes discover this quite unexpectedly. Old blazers that fit through the shoulders will not close at the chest. Fitted shirts and sweaters that worked perfectly before simply no longer do anymore. That has nothing to do with weight. It is a shift in skeletal geometry. The shape of your ribcage has genuinely and measurably changed its outline. This expansion often does not fully reverse, especially after multiple pregnancies over time. Women describe their torso sitting lower, broader, and more settled than before. That is an accurate physical description, not a self-critical observation about your body. The cage protecting your heart and lungs expanded to shelter something extraordinary inside. And in many cases, your body kept some of that new shape permanently. It remembered the room it learned to make for something larger than itself. Your ribcage quietly carries the memory of what it once made space to hold. You were probably told stretch marks happen when skin stretches too quickly. That is true, but it leaves out the most important part of the story. The part that explains why new stretch marks sometimes burn, itch, or sting. Your skin has layers, and the critical one here is called the dermis. The dermis sits just beneath the surface and gives skin its structure and elasticity. Collagen fibers run through the dermis in dense, tightly organized networks of protein. During rapid growth, skin can stretch faster than collagen production can keep pace with. Those fibers tear, small internal ruptures deep inside the skin's second layer, and running alongside every collagen strand in that same layer are tiny sensory nerve fibers. When the dermis tears, those nerve fibers tear right along with everything else. The burning, itching, and sometimes sharp pain of new stretch marks is nerve damage, small-scale, localized, completely real nerve damage inside living tissue in your own body. The red or purple color of fresh stretch marks comes from visible blood vessels. They show through the torn dermis, visible now in a way they never were. Over time, they fade to silver as scar tissue gradually forms beneath the skin. Stretch. Marks are scars, softer and quieter than that word usually implies. They document the speed of your transformation with more accuracy than any photograph could. Your skin was trying to keep pace with something extraordinary happening beneath it. It came remarkably close to keeping up with everything being asked of it. The evidence of that effort is written across your body in silver that lasts. This one surprises people more than almost anything else on this list. During pregnancy, your teeth can actually loosen measurably inside their sockets. Not dramatically, not noticeably in the mirror, but detectably, measurably, genuinely. Dentists can sometimes verify this loosening on x-rays during routine pregnancy checkups. Progesterone and relaxin do not discriminate between which ligaments they target for softening. Your teeth are anchored in their sockets by the periodontal ligament. When that ligament softens and loosens, teeth can shift and wiggle slightly in the jaw. But the mobility of teeth is only the beginning of what happens in your mouth. Gum disease actually accelerates during pregnancy because of the hormonal environment in your body. Increased blood flow to the gums causes swelling and makes them bleed more easily. Morning sickness introduces stomach acid to the surface of your teeth on a regular basis, and exhaustion, cravings, and overwhelm can quietly erode even the best dental habits over time. That combination creates an almost ideal environment for tooth decay to accelerate. Research has found a documented link between severe gum disease and preterm birth. Inflammation in the gums can trigger systemic inflammatory responses elsewhere in the body. Your mouth is not isolated from everything else happening in your pregnant body. It is entangled with your pregnancy in ways medicine is still fully working out. A dental visit during pregnancy is not optional cosmetic maintenance. It is medically important. Your teeth are trying to hold their ground while everything around them softens. They deserve the same attention as every other system that is quietly changing. Here is the thread running through every single one of these 7 changes. None of them are evidence of damage, failure, or anything going fundamentally wrong. They are evidence of a system under extraordinary, sustained, coordinated biological pressure. Your body did not simply contain a pregnancy, it structurally adapted to one. It grew the placenta entirely from scratch and then discarded it completely. It rerouted blood supply, loosened bone, expanded muscle, and restructured nerve tissue. It changed the shape of your feet, your ribs, your heart, and your corneas. It softened the ligaments anchoring your skeleton, your teeth, and your spine in place. And it accomplished all of this while keeping you alive, functional, and moving forward. While you worked, slept, worried, planned, dreamed, and kept going every single day. The body that exists after pregnancy is not a lesser version of the one before. It is built differently because it spent those months building something entirely new. You may never return to the exact dimensions of the body you had before, but returning was never the actual point of what you went through. And that body did something no version of it had ever done before. It made structural, skeletal, cardiovascular room for an entirely new human being. Your feet still carry that memory in the bones that widen to hold you steady. Your heart carries it in the extra muscle it grew to push life forward. Your ribs carry it in the outline they expanded into and partly never left. Not as damage, not as loss, not as something that diminished you in any way. As permanent, physical, undeniable record of something extraordinary your body once did. Something it built from nothing and carried all the way through.